This knee pain, man.
Today we're going to show you 3 tricks that physical therapists use to help treat your knee pain.
Right, and as therapists, it's really enjoyable in the clinic to do a nice technique that relieves the pain, the person smiles, and everyone else in the clinic is happy as well. You really feel like a champ.
You're not grumbling anymore. Your knee pain must be gone already.
Yep, see, it works.
So we're going to go over 3 techniques that we have tried and tested in our clinics over numerous years and often see success with them. Now, you don't have to do all 3 of them every day. Try them all out, see which one feels best for you, and stick to that one.
Now, I personally had great success with these in the clinic, particularly with people with arthritic, total knee replacement, meniscus problems, and they really have done very well. And like I said, people get relief quickly. It's a good feeling. Everyone's happy. All right, a brief explanation why number 1 works. This first technique is the joint itself. If we can decompress it or actually get a gap between the articulating or the surfaces that contact each other, that can be relaxing, reduce pain, particularly if there's arthritic problems in there. And at the same time, we're just going to allow the leg to swing back and forth like a pendulum. So hold on, we're going to show you how it works for real. Okay, for this first decompression technique, you'll need to sit in a chair that's got a firm base and also that your foot is not on the floor when you relax. It needs to be up a little bit. Now, Mike is up on here. You can see his feet are clearly swinging back and forth. I actually put some cushions underneath here and a pillow, and it's still touching a little bit. So I'm going to take my hands, go underneath my knee, right up in that. They call it the fossa, or the crux of your knee. I'm going to pull up gently, and just like the Sam was showing on the skeleton, we want it to swing back and forth, relaxing every muscle in your leg so it acts like a pendulum, decompression or distracting that joint, just like we mentioned. And then you just get it swinging. You can see my hands here are allowing it or kind of forcing it to swing. I'm not doing this. I'm relaxed and get it going. Now, Mike's got something that's going to help some people even more to get more distraction. Go ahead, explain how you're doing that, Mike.
So I just have a cuff weight on, so it's a little more weight, and put it around your ankle distally will help distract the tibia bone from the femur bone here. Again, I'm in a relaxed position. Make sure your hips are relaxed as well. If my hips were engaged, you can see how tight they are. This is going to actually compact the knee joint, especially if you swing too much. So be very relaxed with this. Now, I'm on a firm mat here, so I don't really have to put anything behind my knee because that's going right in that fossa area there. But you can use your hands up here as well. But yeah, just let it swing, distract, and it should feel good if you're having some pain.
That's right. Now, with this, what we have, if you don't have an ankle weight, you can actually put a heavier shoe, or like up where we live in the north, put one of your winter boots on, and that will be enough weight. Typically 1 to 2 pounds is enough. As far as time, if you're doing it and it's feeling good, I would do this for about 30 seconds to a minute, because I would actually hold the patient's knee like this, and then my hands would get tired, and I'd say that's good time. And then I would do that 2 or 3 times. If you're doing it to yourself like this, just go as long as you feel comfortable, and you can repeat it throughout the day as much as you'd like. All right, the second technique, you're simply going to take a towel, roll it up. It doesn't have to get too thick. It's all going to depend on your body size and how your knee is working as far as the mechanics of it. So you'll take a towel, and you're going to put it right here. Now, you can do this in a seated position. I'll show you that. And then there's also going to be one standing next to next to your bed. But you put that towel right up in the crux of your knee. Again, that's a popliteal fossa. Nice term, isn't it? So, and then we're going to actually grab below the knee on the shin. I'm going to scoot out on the edge of my chair so I can lean back. And I'm going to pull, and that actually acts as a lever or a fulcrum, and it distracts the knee. When you do this, you feel good. Like right now, I can feel it, and it does feel good on me. I don't have a knee problem right now. But all these techniques, if they hurt, you don't do them. This is not a no pain, no gain technique on all 3 of them. Should feel good while you do it, and after you're done, get up, walk around. Also should be a good response and feel better. If it makes it worse while you're doing it or afterwards, you put a red line through it, and you do not do that technique. It's not for your knee. Mike, can you show them how to do it using your bed and the towel like that?
So this is a little more aggressive than the way Brad was doing. Maybe you just have some mild knee pain. As long as it doesn't hurt to actually kneel on your knee, this should be fine. Obviously on your bed it's softer, so it won't be as aggressive as this mat table. So just place your knee up on there, towel, same position. And as soon as I start leaning forward, that is mimicking Brad pulling his knee towards his chest like that. Same concept, but you can get a little more aggressive and lean into it that way. Again, hold it for seconds or repetitions, whatever feels comfortable for you. If you really want to get aggressive, this may be for you.
Just wait 1 second, Mike. I also want to emphasize leaning forward, but also putting your butt down towards your heel.
Will help flex your knee more. So if I'm leaning forward like this, I am collapsing my knee, but if you keep your butt down, you're even bending your knee even more, so you're getting more distraction in there.
It's kind of hard to see on camera, but it does when that drops down, distract, only if it makes it feel better. Okay, so it's very important.
Now, if you're younger and you have some knee issues and you want to get your range of motion back, maybe it's back of the knee pain, you can certainly do this in a tall kneeling position as well, but you have to be comfortable kneeling. Same concept, sit my butt towards my heels, and this gets a nice opening in that knee joint there.
That's right. That is more aggressive again. You're going to do that if it feels good, and you're probably younger and pretty mobile.
This feels pretty good for me.
See, there you go, and he's younger and mobile. All right, the third technique is actually created by Brian Mulligan. He's a therapist. He's been around for decades, and this is a nice technique. If it works, it's very simple. And what we're going to do is if your knee particularly does not flex all the way, we want to have good range of motion. That can easily be the cause of pain. Once you free it up, then things get better. So if your knee is tight here, or here, but particularly in flexion, this is a good technique. So the whole concept is the knee does not want to flex further than this, but if you rotate one way or the other, the tibia, which I'm showing here, that can be enough to break things free, so to speak, and get more range of motion without pain or actually feeling good. So I'll show you how you can do that on yourself because it's a little harder than this. Okay, this is the knee in question. Now you need a chair that has a firm seat pan, okay, not a soft, cushy one. That will not work so well. And then I'm gonna go like this to that point where it's a little painful. And we wanna see if we can get to that normal range of motion. Okay, so what I'm gonna do is actually grab below the knee and we're gonna get a hold of that tibia. Now we got a lot of soft tissue that kind of moves. So it's not as easy as it was with Sam. So I'm gonna grab in tight, hold it there, and then I'm gonna first assess the range of motion, say, oh, it hurts there. If I rotate things to the right, I'm actually gonna turn my foot to the right, rotate, go again, see if you get more range of motion without pain. Let's say, that doesn't seem to work so good. Then I'm gonna turn my foot in, grab and rotate that tibia in. We get a little rotation, turn the foot, and then again. Now, what'll happen oftentimes is one way it won't help, the other way it does, and you're gonna work the way that feels better, less pain, more range of motion is a green light to do it, just 5 to 10 times. Probably 10 would not be the one I'd go to right away, just up to 5 repetitions like I'm doing here. Let it go, walk around on it. If it feels better then, as well as while you're doing it, green light, do that 3 or 4 times a day. Again, assess which way feels better, then only do the way that feels better. And after you do this, you'll find that it loosens up in all phases and it will have a good results. Follow the rules, only do it if it feels good while you're doing it and afterwards, and you'll do very well. Now we got to come up with the outro for this.
We have something else to talk about too they could try.
That's a good point. Now, if you're finding that as you do one of these techniques and motion feels better, we can progress to a little bit of weight through it and helping the muscles get stronger. And one thing you can do is sitting in a chair. A firm chair works better. This one's not so good. A chair like Mike's is better, but I can demonstrate. And you put something slippery on the floor. If you have carpet, I'm just using a book with a smooth, shiny cover. I'm going to buy a foot on there. If you have socks on, you can go on a shiny floor. Whatever, make the resistance low. And you can simply go back and forth like this and get things moving. Go back as far as you can. Should be pain-free, particularly if the Mulligan technique was working for you. That'll be helpful, and really be coordinated with that technique. And do this for a few minutes and do it throughout the day. Mike, we have something a little more designed specifically for this.
So this is a Bob and Brad knee glide I am using right here. You can simply sit down and use it. You can also use it in bed. Just set it up to where your knee motion is, and you can bring it back more or closer. You can also change the pitch and angle on it, and this is just another way to get mimicking the same motion here.
That's right, and that is the big advantage of this, is you can change the angle, which can be really helpful, particularly after a knee surgery. You can emphasize quadriceps, or this emphasizes the hamstring strength. And it actually makes it a little easier to flex, we found, particularly, again, after surgery. So it's been working very well for us over the past, I don't know, Bob, 5-10 years, probably closer to 10 years we've been selling these, and people have been happy with them. So not that we're making a sales pitch or anything, but they are nice devices. There you go. We've gave you a number of options and information on how to get that knee working better, pain-free, and keep you moving. And we have another video if they have other concerns.
Yes, you can click the video link on the screen. If you have knee problems still, there's just some different exercises and options in this one.
Options, and more options. You just never know. You always have to have plan B.
Bob and Brad, the two most famous physical therapists.